Hello everyone, my name is Taylor Boudreau. I'm here to discuss the long-term mental and emotional health impacts that coronavirus has had on healthcare workers and our patient population. My target audience would be the hospital board or the administrative staff. So as we all know, ever since coronavirus made its presence known in late February, early March of this year, it has changed a lot of aspects of our daily living. We are learning about this virus every single day. It seems to be ever-changing and can be, mild in some cases and fatal in others. And so with that comes, a good amount of fear and anxiety of the unknown. And this fear and anxiety actually became more personal for me as I found out today that I tested positive for COVID after taking care of 2 patients for an extended period of time. So we're going to talk about some factors that contribute to mental and emotional health distress in healthcare workers and our patient population. One of those being a new policy that has been implemented in hospitals nationwide is a restriction in visitation to patients who have coronavirus. For patients that have symptoms severe enough to be admitted into a hospital, they are admitted without family members who are able to come up with them. They have to remain in the hospital for the duration of their care without visitation from their loved ones. And that can add a lot of stress and fear for our patients, and it can add a lot of stress and strain for the healthcare workers. This is a scary thing we're all navigating. It's new for everybody. And as patients are taking it day by day and learning new things, and, they're in an environment that is scary to them and, that they're having trouble understanding. And nurses are having to take care of a fairly sick population while also taking on a sort of surrogate role of a family member or a loved one to these patients. And that can create a good amount of stress and strain for both parties. Another aspect of this is, some of these patients get very, very sick, and some of them pass and expire in the hospital without the presence of their loved ones. Their loved ones are not allowed to come in until they have unfortunately already passed on. So that's another aspect of how this can impact both patients and healthcare workers. Nobody deserves to die alone, and so that leaves a heavy impact on everybody involved. So in doing my research for this project, I came across an article that discussed a program implemented in Tucson, Arizona, where they were trying to target healthcare workers who were working on the front lines of the coronavirus pandemic. And they were offering residential trauma counseling for varied amounts of time, 7, 14, and 30 days. And you can stay at this retreat and get trauma counseling, access to group therapy sessions, of course, COVID safe, equine therapy, yoga, mindfulness exercises, and for those who would prefer to keep a safe distance, they offered telehealth appointments where you could still have access to licensed professionals who you could talk to about the emotional impact that this pandemic has had. So I think that was really helpful and important that people are taking the extra steps and looking at how we can offer a reset for these healthcare workers. We're facing this pandemic inside and outside of the hospital. We face it head on when we take care of our patients, but we also have to be mindful every time we leave our houses. We have to wear our masks to protect our community. So you never really get to shut off, and I think that's why I thought this article was really important, is that it did offer a reset for this targeted population of our healthcare workers. Another article that I came across discussed the implementation of medical social workers, both inside and outside of the hospital. While our patients are in the hospital and they're navigating this pandemic, medical social workers can be an instrumental role. They can play an instrumental role in providing resources for our patients. Inside and outside of the hospital, like I said, they can provide chaplains and someone to help, navigate this emotional strain while they're in the hospital. But, that doesn't end once the patient gets discharged. So they can help find ways to continue the care once the patients are discharged, and even, with the families as well. And I thought that was really important. But what I think is something that would have to be addressed for the mental and emotional impacts to be lessened would be some kind of revamp to our visitation policy. You know, while restricting visitors has been instrumental in reducing the spread of coronavirus, you know, you can still control it while you're in the hospital, but, you know, family members you can get it outside of the hospital. You can get it in the community. So there's got to be a way that we can find a safe way to allow visitors and have that sense of connection between this patient population and their family and their loved ones while they're going through the coronavirus. It's a scary time for everyone involved, and that can, I think, severely lessen the impact of the emotional strain and the long-term effects that this pandemic has had. So I would challenge the hospital board to get creative, look for ways that we can implement visitation, you know, Skype, FaceTime. You know, we have the means to have a really controlled environment in the hospital. So I would challenge the hospital board and the administrative staff to find ways to help allow visitors and give these patients that feeling of support that they so desperately need during this challenging time. Thank you so much.